Hello and welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Bad breath, also called halitosis, can come about by having poor dental health habits and may be a sign of other health problems. It can also be made worse by the types of food one eats and other unhealthy lifestyle choices. Between 35 and 45% of the people world over have some level of halitosis. However, everyone suffers from bad breath at some point in their life and at some time during the day. Bad breath sufferers are more likely to suffer from stress than non-sufferers. On the program with us today is Dr. Olutola Eweka. Dr. Eweka is a lecturer and consultant of oral medicine in the Department of Preventive Dentistry, College of Medicine, University of Lagos. You're welcome to the program, Dr. Eweka.
Thank you very much. It's good
That
to be
was
here.
that was a brief description, but I'm sure you have a more elaborate definition of what bad breath or halitosis is. So let's have it.
Okay, well, it's actually quite simple. Halitosis is just bad breath, which many people, as you said, actually almost everybody do have halitosis at one point or the other. So you can call it bad breath, foul smell, any way you can describe an odor that comes out of the mouth. So that's just halitosis.
Okay, so what would be the cause?
Okay, for the causes, there is known that there are several causes. We have the local factors and the systemic factors.
Okay.
And for the local factors are things that occur within the mouth that will result in this problem. And the primary one is poor oral hygiene, where somebody that does not take care of the mouth, normally the bacteria in the mouth that is there as a normal commensal within the mouth, which we need to clear every day. But if somebody has a bad habit of not clearing the mouth by toothbrushing, all this accumulates in the mouth and gives off this bad breath we're talking about. And then, of course, other local like infections within the mouth, inflammation of the gum we call gingivitis, or destruction of the supporting tissues, caries within the mouth where food accumulates within that hole and then decompose and begin to give off the smell. So
you mentioned the word there, commensal. What does that mean?
Commensal means that they reside within the mouth as normal, as part of the body itself. They are there. You cannot get rid of the bacteria. They are there. They live there. But we need to keep washing them off, and then they come back again, and then you wash them off and come back again.
Is there any reason why they live there? This bacteria, is it doing anything for us in the mouth?
Yeah, well, most of the time, what it will do in the mouth is just causing diseases like dental caries, inflammation of the gums and all that. There are just some things that are with us that we cannot get rid of, just like on the skin. You have bacteria on the skin, and all that. It has its protective side as well, but they do more damage than good. So we have to have measures in which we can, get rid of these things.
Okay, so now I'm curious. We go to bed, sleep, wake up. We know we have to have a bath, take a shower, but it's not like we are smelling, Can't it be the same for the mouth, whereby, okay, yes, I do need to brush my teeth, but they don't have to smell first? Is it possible?
Well, it's not really possible because the mouth is an enclosed cavity.
Okay.
You understand? It's closed. And when it is closed, the bacteria has enough time to do whatever it wants to do, break down the proteins within the mouth and give off these gases. So by the time you open up your mouth when you wake up in the morning, everything comes out as bad odor, but we call it normal, physiological, because it happens to us. Normal, it's not a problem.
Okay, so once you brush
in the morning, you get rid of the smell.
Okay.
Where it is a problem is in when during the day it's persistent, then you say that is a problem.
Okay. So staying with the local causes now, how does one prevent the persistence of it, if you will, since more than likely it would happen when you just wake up? But after that, how does one prevent, such a condition?
Prevention is very easy. The most important thing is the toothbrushing with a fluoride-containing toothpaste and a very good toothbrush. Once you can get rid of most of these things, you brush twice a day, in the morning and in the evening before you go to bed, and then you do dental floss. As we said, the local factors are the main things. Food can pack within the teeth, so we need to use our dental floss to remove these things.
Okay.
Then you can also use mouthwash, to just rinse out anything that is bad. And then if you do eat after your lunch, like you can't brush after your lunch, you can just rinse out your mouth. That removes the food debris from the mouth and then also get rid of the bacteria, and then your mouth feels fresh.
Okay. People talk about brushing at least twice a day, morning and night. But flossing, that seems to be a new concept. I'm sure if you ask the average person on the street, they probably don't know what flossing is or what a floss, if that's what they call it, is, So why the flossing? Must it be every day?
Well, we want people to adopt a very good habit. Just like we say, brush your mouth. I mean, you could choose not to brush your mouth if you don't want to. You understand? But flossing helps to get rid of food packing in between the teeth. And if you do it every day, you have been able to cultivate a new habit of keeping your mouth clean. And then floss is something very simple. We don't say you should do it all the time. Just in the evening, when you're relaxing, you're at home from work, just do your flossing, brush your mouth, and then go to bed.
Okay. Now, a lot of people have a kind of depression in the tooth. That's the bigger teeth. Those ones, the molars and premolars that are bigger. A lot of people have a depression somewhere in the middle. So after eating, especially if you're taking something like, well, let's say bread, there'll be a little bit there.
Yeah.
Now, is that depression normal, or it shouldn't be there, first of all?
Okay, this depression is actually what we call fissures.
Okay.
They're actually curves and lines on the teeth, and that is normal. That's the normal anatomy of the tooth. Now, because of that, food tend to stick on that, particularly the sticky foods.
Yes.
Like chocolates, bread, as you said, biscuits and all that, tend to stay on that. And then if you leave it there, the bacteria we say is in the mouth, begin to feed on the remnants of that food on the surface. And of course, apart from causing caries, they could also give off this bad odor.
Okay, so basically, that's all there is to local causes.
There are so many other causes.
Okay, yes, you did talk about gingivitis.
Gingivitis, that's inflammation of the gums, where there was bleeding of the gums, and then the blood itself becomes occult, like it becomes stale, and then begins to bring out the smell. There could be oral infections like Candida, sore throat, other infections in the mouth. There could be people that wear dentures and they don't clean it properly. The dentures, the surface will be a place where the bacteria would, stay on for a long time because they are not cleaning. So it gathers all this dirt. The most important thing is once there's a room for bacteria and food to accumulate, then you're going to have this. Now, most importantly is the tongue. Now, many people brush the mouth, but they forget the tongue. The back of the tongue is far from where you have easy access to. And then you see that it's slimy. It's like the bacteria love that area. It's hidden. So they like to stay at the back of the tongue. So if you brush your mouth and you don't brush the tongue, where the bacteria that are there will just begin to act, on the food and then bring out all these gases. So the tongue is paramount. Cleaning of the tongue is paramount in prevention of the halitosis.
How does somebody clean the tongue? Is it with the brush or a tongue scraper?
Yes.
Both are okay?
Both are okay. Now, a lot of brushes are coming up these days that the back of the brush, if they see this is the brittle, the back of it actually has a tongue scraper. Then you can actually go and buy a tongue scraper. It's really available. Many chemists or, big supermarkets have it. Just use it to just clean the tongue. Or your normal toothbrush, even the bristles of the toothbrush will do the work.
Now,
clean it very well.
Most people are very sensitive, because the throat is just at the back of that place. So how do they now get everything out without throwing up?
Well, I guess it's something you have to master. Maybe at the beginning you feel like you want to vomit. But after a while, really, you get used to going to the back without throwing up, which is very, very important. But you need to get to the back of the back because that is where they really
And do we need to do this every day?
Every day. When you brush.
And every time we brush?
Every time you brush. You must brush the tongue, particularly the back of the tongue.
How about the tongue scraper? Let's assume somebody's using tongue scraper.
Yeah.
Does that have to be every day or you...
Well, it depends on how you want to use it. It may not be every day. If you don't have the problem, you may not want to use it every day, maybe once in a while. But if you feel you do have a problem, then go ahead and use it as often as you feel it will help you.
Okay. From the conditions you mentioned so far, I imagine that, a bit of adjustment here and there by the person will eliminate these problems.
That's right.
But you mentioned oral candida. What does a person do about oral candida?
You have to go see the doctor. If you have any infection in your mouth, you need to go see the doctor. Even gingivitis, periodontitis, you really can't do anything about it. Even if it's dental caries, a hole in the teeth that accumulates dirt and all the spaces in between our teeth, which is normal, but food tend to, get stuck in there. You need to go to the hospital, to the dental clinic, and see your dentist